Want volume or a lift? Well, this is how I guide my patients towards the optimal choice for them. So what happens is a lot of times, either due to breastfeeding or due to weight loss, we lose the breast volume. However, even though the breast volume has been lost, the nipples are still sitting above the breast crease. Another way of looking at it is if I go from the shoulder to the elbow and go halfway in between and draw a line straight across, the nipple should be right there. And that is actually anatomic landmark for both men and women. So if the nipple is close to that line, then the patient would do very well with a breast augmentation. Now, if the nipple is below that line, you still can get away with the breast augmentation as long as the nipple is above the inframammary fold. And that's what's called a pencil test. If you put a number 2 pencil in the breast crease and then you let the breast fall, the nipple has to be above that number 2 pencil. Now, the problem becomes if the nipple is below that line but above the breast crease, you have to go with a bigger implant to fill up that skin envelope so you can get the nipple a nice lift. And I, in general, don't like that. Whenever I get a patient who's in their, for example, 40s, I tell them that is going to make them look matronly if we go bigger, because the shoulders get dominant and they look wide, and it actually does the reverse. It masculinizes the patient instead of feminize them. For those patients, really, when the nipple has started to get close to that inframammary fold crease, I definitely tell them, listen, I recommend doing a breast lift. I don't take the nipple off. I just kind of pull it up into place, re-inset it through a new circle, and then I go in underneath the breast and I put in a small implant so that we can get a really nice upper pole fullness and get a very nice teardrop shape to the breast.